Recently, Taiwan's Executive Yuan passed a draft proposal to establish a BioBank. Currently, more than 1,400 human samples are stored in the bank, 1% of which are from the indigenous. The proposal does not, however, take the Indigenous Peoples Basic Law into consideration. This requires first consulting with the indigenous. In response, the Department of Health say it would discuss the matter with the CIP. Samples collected from the indigenous by a hospital were destroyed when controversy arose because the hospital had not notified the indigenous in question of how the samples would be used. The BioBank proposal clearly states that participants have the right to understand how the bank will be established and managed, as well as how the samples will be used. The rules require that the indigenous be consulted when collecting samples. The Department of Health says it did not add an additional article to the proposal because it is already clearly stated in the Indigenous Peoples Basic Law. The government or private party shall consult with the indigenous to obtain their consent or participation, while sharing with them the benefits generated from academic research in indigenous regions. The DOH says whether the indigenous share in the proceeds of BioBank depends on whether the samples are used for public or commercial purposes. Deputy Minister of DOH, Chen Zaijing, says,
if the samples in the BioBank have commercial use, then the indigenous can share in the proceeds. Of course, the benefits must comply with the Indigenous Peoples Basic Law. If use is for public purposes, naturally, it will not be shared.
Consent or participation of the indigenous is required in this matter. Determining who truly represents the indigenous, however, is no easy task.
When conducting medical research, it is important to get consent. Who, however, represents the indigenous? Is it the chief, leader, or head of the neighborhood? We need the indigenous to give us a clear answer. Once we receive that, we will be happy to comply.
In response to the researchers' request, the DOH says if the proposal is passed, it will discuss the matter with the CIP to provide a clear standard. TITV Weekly.